Hi, this is Town of Islip Supervisor Angie Carpenter with our Supervisor Spotlight. We're broadcasting here from the studios of Long Island News Radio at Long Island MacArthur Airport, and thank you so much for joining us. And I am delighted to be able to introduce you to someone who's not so new any longer, but fairly new to the town of Islip and the Islip medical community, Dr. Kimon Bekelis, who is from Good Samaritan Hospital Medical Center, part of Catholic Health Services. And just an interesting story and history. And those of you who are watching us on TV and not the radio are probably saying, oh my God, he's so young, which was my reaction, and I'll be honest with you. But he is just so experienced and, you know, has a world of knowledge. And we are so really lucky that he's here sharing all of that with us here in the town of Islip.
Thank you so much for having me.
So tell us a little bit about when did you know that you wanted to be in medicine?
Well, I really don't know. My parents tell me it was when I was very young.
Okay.
So I always wanted to be in medicine as far as I can remember myself. And then when time came to obviously make a final decision, there was no doubt in my mind. And I was always fascinated by the nervous system, its complexity, and also all the stuff that we can do to improve disease that's otherwise devastating. And it was very clear to me that I wanted to be in the neurosciences. And then the ability to intervene and do an operation and change the outcome of something so dramatically led me to neurosurgery, and eventually in the treatment of stroke and brain aneurysms into neurovascular neurosurgery. But yeah, as long as I can remember, I wanted to be in medicine. If it weren't for neurovascular neurosurgery, I probably wouldn't be in medicine, though, because that's my passion.
Your interest. Yeah. The good doctor is not from the United States.
Nope.
He was born in Greece. I'll let you tell a little bit about that.
Sure.
history.
So I was born and raised in Greece. I spent 24 years there. I went to medical school in Greece, and then I came to the United States to do my residency. I did my residency at Dartmouth, and then my fellowship at Thomas Jefferson University in Philadelphia. It was a great experience growing up in Greece. Obviously, medicine rooted in Greece, and there's a lot of passion for it. So it was great. But I felt that to grow professionally and to be able to treat patients with the best available tools, I needed to come to the United States to have the ability to perform the procedures I wanted to perform. When I graduated medical school, pretty much in the entirety of the world, strokes and brain aneurysms did not receive the treatments the cutting edge treatments that we offer in the United States today. And so I was passionate about the diseases, the disease processes, the stroke, the brain aneurysm problems, and I wanted to work on learning how to treat them in the most advanced ways, and this is what we've done.
Well, just listening to you talk, certainly the passion for it comes through in your voice. But stroke is something that, I guess it can be prevented
Absolutely.
In certain instances, but maybe not really if you're predisposed to it. And there are a lot of conditions that would take you to that. And, I would hope that we would share some of that. But just back to the personal. So at 24, you come to the United States, and, I can just sense a little bit of an accent, but not really.
Sure.
So growing up, were you speaking English as a child?
I was, yeah. I was speaking English since I was 6. And so, I would speak English, Greek, and a little French. Because you have to when you grow up in a country where, the language, obviously one of the most ancient languages, but really not very much spoken outside of Greece. So you had to adjust.
Well, I think in European countries, they're a lot
Extremely
better about
common.
languages than we are here. Kids take, language in high school or maybe grade school now.
Grade school, was in grade school. Yeah, and so that's how I kind of started to speak English, but I spent a lot of my time while I was in medical school, I spent it in the United States, doing rotations in the United States, in several hospitals, and kind of doing part of my medical education in the United States.
So when you were in medical school in Greece and you did rotations here,
yeah,
what were some of the hospitals you were at?
So I was at Brigham and Women's Hospital in Boston, part of the Harvard system. I was at Johns Hopkins Hospital. I was at the Mayo Clinic. That's about it.
So anyone listening, I mean, this is incredible when you think about it. I'm not going to ask you how old you are, but if you came here when you were 24, you're still pretty young. But Dartmouth, Harvard, Mayo, Johns Hopkins, Thomas Jefferson, has an incredible reputation. And here you are in the town of Islip. How lucky are we? That's really incredible.
Well, thank you. And the reason I came to Long Island and obviously the town of Islip was because I wanted to start a program in a community that really needed it. And treating stroke and brain aneurysms is a very particular field. You need a tremendous amount of infrastructure that involves both the particular operating rooms where we do these procedures, the biplane angio suite, but also a significant amount of care in the neurointensive care unit and other units. And not a lot of facilities offer that those options. Now, most places in the U.S. where these options are offered are tertiary care centers, extremely advanced and really established programs that offer those services. And I had opportunities to go in some of the biggest centers in the U.S. But seeing the opportunity here, and the reason I heard about the opportunity was because one of the residents I did one of my co-residents at Dartmouth had actually taken a job here as a neurosurgeon as part of a group here. And so he introduced me to the opportunity, which was completely outside of my, it was not on my radar at all. And so by coming here, I have an open mind always, but by coming here, I saw what was surely a unique opportunity. There was an area where there was an absolute need to treat these patients, but there was really still no ability to treat them appropriately. They would travel for hours to get appropriate treatment, and there was really no center. There was no biplane yet, and so I had the opportunity to be involved from the very beginning, to even participate in the design of where the doors would go in the rooms. And so I thought that's a once-in-a-lifetime opportunity, and I kind of jumped in both feet, and here we are today. But that's the reason I'm here.
Yeah, well, I think that's just really commendable. And I would hope that part of the decision, this is your field that you practice in your profession. You want to make a difference, obviously.
Absolutely.
That comes through loud and clear. But there's another part of a person's life. You're not always working.
Absolutely.
So, I feel that we want to live in an environment that we can be comfortable with. And I would hope that everything that we have to offer here in the wonderful town of Islip on Long Island really has a lot of appeal. And those of us that have been born and raised and have grown up here sometimes don't realize that. And someone coming from the outside who sees, our proximity to Manhattan, the beautiful beaches and the shoreline and everything we have to offer, you wrap that all together with a professional opportunity.
Absolutely. And to be honest with you, I knew a lot about Long Island before I came here. I didn't know about the opportunity, obviously, until I heard about it. But as I said before, I trained at Dartmouth and in a fairly rural environment, obviously, in New Hampshire. And every opportunity I had, I would come to New York, and I had a lot of friends on Long Island. So I was out here always. So I really enjoyed being here. And so that aspect of coming here was the easiest one. The most challenging one was the professional opportunity and getting it to be the way I wanted it to be. But living in Islip, I'm a local. I'm in East Islip, as you know, being part of the community was something that was very exciting. That was the easiest part of the selling for me.
Well, that, as the town supervisor, that makes me feel great because, I say all the time, we're the third largest town in the state of New York, but there's still a sense of hometown and community.
Absolutely.
And people caring for one another and neighbors, and it's really a good place to be.
You're absolutely right. It feels like a small town every day. I feel like I've operated on everybody in the town of Islip, but really it isn't. It's a very big town. So
I would ask that you stay with us. We will be back in a few moments to hear more from Dr. Bekelis about the incredible unit that they have at Good Samaritan Hospital. Welcome back to Supervisor Spotlight. This is Angie Carpenter, Town of Islip Supervisor, here in the studios at Long Island MacArthur Airport. Got to get that little plug in for our airport. We have with us today Dr. Kimon Bekelis, who heads the unit at Good Samaritan Hospital that deals with neurosurgery and brain stroke and brain aneurysms. I'm reading it off his jacket. But tell us a little bit about, Good Samaritan Hospital is part of Catholic Health Services, and fortunately part of a bigger system than just one hospital, and that's important.
For sure.
So that they have the resources, they have the vision when they see a need to address it and to make a difference in the community. And you were in the right place at the right time and were recruited to come here and talk about how exciting it's got to be to start something like that from the ground up.
It was really a dream come true for me. It was extremely exciting. It involved a lot of hard work by a lot of people. It definitely wasn't a one person's job, but there were several key players that worked hard, and I think a lot of us had a lot of sleepless nights, especially before opening the program. This was not an overnight thing. It was a vision that started from the leadership of CHS and the leadership of the neuroscience department at Catholic Health Services about 3 years before the opening date. But
so things like this don't happen overnight, obviously.
Absolutely not. And so the entirety of the investment was up close to $17 million, and that involved a new operating room called the biplane angio suite, a new neuro ICU, which is the intensive care unit, and a step-down unit. Additional personnel, up to 65 new employees were hired at Good Samaritan Hospital just to support this very program. And on a personal level, a lot of people followed me from places that I've been in the past. I've had my nurse practitioner came with me. She was at Beth Israel in Boston at the Harvard Hospital, but she was with me at Dartmouth before. And my lead technologist followed me from Thomas Jefferson. He was the lead technologist there. And so
you really built
absolutely. So I brought with me about 5 different families, and so I had a responsibility, obviously, to these immediate families to make sure this endeavor is successful, but also to the entirety of the community and the hospital. And with a tremendous amount of hard work that involved, as I told you before, even designing where the doors would go in the rooms, and then trying to provide the best clinical care every time for every patient at the best of our abilities. And 600 patients later, we were very proud to receive the Comprehensive Stroke Center certification by the Joint Commission, which is the top-tiered certification for any hospital offering stroke services. It signifies that your hospital is at the highest level of care when it comes to stroke and brain aneurysms. And this comes not only from the hard work in the angio suite and the good outcomes, but it also comes from the tremendous amount of coordination at the quality level, the ability to look at every case and make sure the outcomes are the best every single time.
If I could just interrupt.
Absolutely.
I mean, the enormity of the sheer, trying to think of the right word, but the sheer, it's just at the highest level to get that accreditation
for sure
for a new program from, something that you started, from the ground up. People scamper to get that accreditation for something that they've been working at for years.
Absolutely.
But to do it from its infancy is really quite a testimonial to everybody that was involved in it.
Absolutely. And I'm very proud of every single person. To be honest with you, most hospitals take a while to get there. They first go to primary stroke center, then to comprehensive stroke center. It's a process that takes several years. It took us just over a year, and you were there at the ribbon cutting.
Yes,
so
I was. And just
took,
seeing that equipment is mind-boggling,
and so to just see that transformation, but I really, I couldn't be happier in a place, and the people are local, and they care about the community. They gave this project their all, and I couldn't have been happier with the obvious outcome. And the best is yet to come. We've only treated 600 people. I want to make sure every single person with a stroke or a brain aneurysm in our immediate community gets the best care possible, and that's what we're going to try to do in the future.
Well, I think we're very fortunate on a number of levels, none the least of which, as I said earlier, you're part of Catholic Health Services, part of a system that is headed by Dr. Alan Gersey, who in his own right, in the cardiovascular field is very well renowned and respected.
Absolutely.
He heads up Catholic Health Services, and his vision, in his own quiet, unassuming way, saw the need and corralled, the support and resources for it and made it happen.
Absolutely, and he has been the driving force together with a lot of the leaders, together with Dr. O'Shaughnessy, the Chief Medical Officer, together with Dr. Mullins, the head of neurosciences for CHS, and also the local leadership at Good Samaritan Hospital, our president and the Chief Medical Officer locally, and everybody. I've never encountered resistance in any of the crazy ideas that I had to make this a reality, and so I'm extremely grateful, and I think only good things can come in the future.
Oh, we're definitely going to see that. I just have every hope and confidence that it will. Tell us a little bit about some of the other things that you're involved with. The commissions that you serve on. For
sure. So obviously, we do a lot of clinical work, which is important at the patient level, but there's more things to be done at a higher level that have to do with stroke management, stroke protocols. That does not only affect, and these initiatives do not just affect Good Samaritan Hospital, ISLIP, or our immediate community in Suffolk County, but involve the entirety of the United States. And so I'm heavily involved both nationally and locally in committees that have to do with stroke, that have to do with neurosurgery, and I participate a lot in the guideline creation when it comes to these treatments, because I do believe that we can help as many patients as we can as physicians, but unless we change the protocols, unless we change the rules about how stroke is cared for, we will not be able to make an impact nationally. And so we do a lot of studies when it comes to stroke. I still have a team from Dartmouth where I hold an academic appointment. I still have a team that does research there, and we look into where patients should go when they're having a stroke, what's their best disposition. And so a significant amount of our work has been published in large academic journals, and we're really trying to affect the other medical community outside of Good Samaritan Hospital or Catholic Health Services to better understand stroke and better help these patients.
And it affects so many people, and I don't know if people are as much aware of it as they perhaps should be.
You're absolutely right. People do know the word stroke or do know the word brain aneurysm, but awareness is not very prevalent. And another important point, we're very involved with one of the most impactful foundations when it comes to brain aneurysms, the Lisa Colagrossi Foundation, which was founded when Lisa died from a brain aneurysm after being on air. She was a reporter. She died shortly after her broadcast, and her husband, Todd Crawford, has created this foundation who's been and has been really, the mission has been to increase awareness, which is exactly what you're saying. And he's done tremendous work. We're the only facility in New York that's actually supported by the Lisa Colagrossi Foundation. And I'm also working hard on awareness on the stroke side. I'm on the board of directors of the American Heart Association when it comes to Long Island, and I'm trying hard to increase awareness there. And you see they have a lot of events, and I'm sure you hear about them all the time, where we're trying to get the word out. Not only understand stroke, but know that it's not a disease that you don't have a choice. You do have a choice, and we have treatments today that we can offer that can completely change the outlook of stroke.
Well, there certainly is a correlation, between heart disease and stroke, and that's something else that most people might not be aware of. But I would like, in our final segment, which we're going to be heading to a little break now, if we can share some of the protocols or some of the things that people should be aware of, what they can do to help in instances when they might suspect a stroke. We will be back in a few moments with a good doctor here on Supervisor Spotlight. Welcome back to Supervisor Spotlight. This is Angie Carpenter, supervisor of the wonderful town of Islip. You'll forgive me for being partial, but it is a great town we live in.
Absolutely.
In the studio today, we have Dr. Bekelis, who heads up the Stroke and Aneurysm Center at Good Samaritan Hospital, which is part of Catholic Health Services, right there on Montauk Highway in West Islip, at the foot of the Great South Bay. It's just a great spot on Long Island, not far from Robert Moses and the beaches and Fire Island and all those good spots that we have. But the good doctor was telling us about the program that they set up at Good Sam. And what I'd like to do is share some information on prevention and awareness and what anybody could do, to make sure that if someone in their life might be affected by a stroke, how you can intervene to possibly help the outcome not be as devastating as it could be. And I'm thinking of the TPA shot that can be administered and being aware of a person's environment and so forth. So share some of that with us.
Absolutely. So, as you're saying, prevention is key. I obviously participate to a large degree in the treatment of stroke, but I tend to say that if there is a day where I'm out of business, that's a good thing.
You would find something else to do.
If we can prevent every stroke or every aneurysm rupture, that would be amazing. On the stroke side, a significant amount of strokes are preventable. And the reason for that is that we know what causes a stroke, what risk factors put you at higher risk for a stroke.
So tell people, what are those?
And those are very similar to the heart disease risk factors. And those are four main risk factors: smoking, high blood pressure, high cholesterol, and diabetes.
Okay, so go back to the second one that you said, high blood pressure. A lot of people don't, and I'm very lucky, great blood pressure all the time, but people don't realize, they think high blood pressure, well, big deal, let's take some pills, it's not a big deal,
Exactly.
But it is a big deal.
It absolutely is. And the problematic aspect about these risk factors is that most of them do not cause loud symptoms, do not hurt. High blood pressure doesn't hurt.
Right.
So people don't
necessarily... Diabetes, same thing.
Yeah, you don't necessarily feel the need to address it unless it bothers you. And so people can ignore it for several years, might take their medications, might not take their medications, might not control it very well. Every single day that passes with an uncontrolled blood pressure, you put yourself at higher risk for cardiovascular disease and stroke. That's extremely, we know that very well. We have very good studies. In addition to that, obviously, if you have these risk factors, have them controlled. Follow up with your primary care provider. Follow their instructions. In addition to that, exercise. Any amount of exercise decreases your risk of stroke and cardiovascular disease, obviously. Now, this is what we can do to prevent a stroke. Identify the risk factors and treat them. Follow up with your doctor. Make sure you follow their instructions. When it comes to identifying a stroke, because obviously we will not be able to prevent every single stroke, but the most important thing you can do is to act in a very fast way when a stroke happens. And that's why the American Heart and American Stroke Association have come up with an acronym called FAST to really hammer home and exactly and explain to the public what they need to do. And FAST really is an acronym that involves four things. If there is face drooping, arm weakness, or speech difficulty, those are the initials, it's time, that's the T, to call 911. And it's important to call 911 and not drive yourself to the hospital. The reason is 911 most of the times can direct you to the appropriate facility where you can get the appropriate care you need.
Well, also, too, in our environment here on Long Island and, in our town, fire departments, the ambulance districts, all these guys are EMTs that are on the ambulance. They can stabilize the person immediately and be able to identify the status that they're in when they, got the call. When was the last time they were coherent?
Absolutely.
To help the clinician, the doctor, make the appropriate decision once they get them.
You're 100% right. And we do a lot of work with the community and the EMS providers to educate them and direct them so they are on the very good spot and they can understand this process very easily. So what I always say is, if you're thinking that somebody that you're with or yourself is having a stroke, call 911. It's not harmful to get to the hospital and identify whatever is going on, even if eventually you end up not having a stroke.
Right.
The chance of having a stroke and not treating it on time can be detrimental. And that's maybe the most important message when it comes to identification and treatment for stroke is time. For stroke, you need to act fast. We have limited windows where we can do things to completely change somebody's life from permanent disability to a life without any issues. And what we have as tools today are both medical tools, medications like the IVTPA, the clot-busting medicine that we have, which we can give from 3 to 4.5 hours.
But that is very specific, because that can't be given unless it meets that criteria.
Absolutely.
And you've got to be able to quantify, when was the person coherent last?
Exactly. Time. Were they bleeding before? You cannot give it if they were bleeding. And that's where we come in as endovascular practitioners. And, the procedure we do, the mechanical thrombectomy, we can do even if somebody has been all the way up to 24 hours out from a stroke, as long as there's still salvageable brain, as long as there's still brain that we can go and help with allowing the blood to flow back in it again. And the way we identify that is with advanced imaging techniques, which Good Samaritan Hospital had from the first day of the program opening, what we call CT perfusion, with CAT scans that really are able to identify whether the brain is alive or not by looking at the real-time perfusion properties of the brain. And so, we are able now to push the to push the time limit all the way up to 24 hours. It doesn't really mean that if you're having a stroke, you can wait up to 24 hours.
No.
The sooner, the better your outcome, but we can still treat you all the way up to 24 hours. And so now the EMS community is changing the way they treat stroke on the field. If they realize that it hasn't been more than 24 hours since you've started having symptoms, they will act like this is an extreme emergency, and it is.
We're very fortunate here. Most of the providers are volunteers, but I cannot tell you, and this is the time of the year when we're having all the installation dinners. I was at Exchange of the Islips dinner Saturday night, and Central Islips coming up in another week or so. But these guys, these men and women, take it so very seriously. They really do, and they go for training constantly, and they are really on the top of their game.
Absolutely, and there might be volunteers on the EMS side, but I noticed that a lot of them are in the medical community, working in hospitals, doing some other job in a hospital, and they volunteer their time to help people in the community, which I think is one of the nicest things.
You see that all the time, And again, this dinner the other night, they were honoring some of the members of the department who had served our country as veterans, and who's in the police department, who's in the fire department in the city, and then they're coming home and they're volunteering.
Yeah.
It's really, really incredible.
It is remarkable. And for stroke in particular, we do need this dedication. And they are very passionate about stroke. They identify stroke victims. They bring, since Good Samaritan Hospital has been a comprehensive stroke center, we've seen a tremendous increase in the volume of these patients coming to us, because EMS realizes that that's the place where these folks are going to get comprehensive care. And really, the difference between getting a procedure now versus getting a procedure an hour or 2 hours later can be the difference between permanent disability or death and complete independence.
Yeah, and you're talking about people who might have been paralyzed, lost total use of one side of their body, and because they were gotten there in the right appropriate amount of time with the information that was needed, were able to get that clot-busting shot that you spoke about and lead a normal life otherwise, and hopefully be more aware of their lifestyle, and so that they can prevent something in the future.
Absolutely.
I know that Good Samaritan Hospital has Good Samaritan University, and they do these wonderful lectures in the community, and I know you're involved in that too. So I just ask everyone to, when you have the opportunity to see something like that in your local library, firehouse, wherever, the hospital, and I must give credit to Southside and Northwell too. I mean, I know you guys do a lot together.
Absolutely.
Everyone's there to make a difference in the community.
100%.
And I can't thank you enough for coming
My
down
pleasure.
today and letting us get a little glimpse into what the Good Doctor is all about. And
Thank
we're
you.
so grateful that you're here.
My pleasure.
And look forward to seeing you again in the future.
Absolutely. Thank you so much.
Hopefully not at the hospital, though.
No.
Okay.
Take care.
Thank you so much for watching. We'll see you next time on Supervisor Spotlight.